All right, it's episode 4, Knowledge Bomb Wednesdays. This week our theme is knee pain. So just want to go over it a little more. I've been posting some stuff about knee pain, but it's really common and it's really debilitating in a lot of sports, a lot of athletes, CrossFit, triathlons, running, all sorts of stuff. A lot of people deal with knee pain, and in all honesty, it gets treated pretty lousy in the current medical model. So one thing I always talk about when you have knee pain is, was there direct trauma to the knee? Did you run and fall in a hole and twist your knee? If you say yes, then I'd expect your knee to be the problem. But if you get knee pain without trauma, what you need to do is you need to check somewhere else. And usually, pain in the knee comes from either something in the hip not working correctly or something in the ankle not working correctly, or a combination of both. The knee is the whipping boy of the body, and it just gets really beat up. So essentially your knee wants to stay in place like this, and it wants to be pretty stable. It gets support from the hip up top and support from the ankle down low. So if you got a shitty ankle or a shitty hip, the thing that's going to suffer the most is the knee. What happens is a lot of doctors focus just on the knee and not really do a good job of understanding the history of the patient. So like I said, if you've had trauma in there, yeah, you're going to have a knee problem. But no trauma in a knee problem, you need to check somewhere else. So if you've been dealing with knee pain and no one's addressed the actual problem of it, especially the ankle or the hip, it's time for a new doctor, and find a doctor that's going to figure out what's going on with you biomechanically all over the place instead of just focusing on the symptoms. Thanks, guys. We'll see you next week.